All right. Well, hello, good evening, everybody. My name is Nicole Hemmenway, and I am the CEO of the U.S. Pain Foundation. We are so excited for you to join us this evening to understand neuropathic pain. We're going to be talking about treatments and answering questions with special guest, Dr. Helen Blake. So before we begin, I just want to go over a couple of items that we're going to be covering tonight. First is our housekeeping items. We're just going to talk a little bit through what's going to happen this evening. I'm going to share a little bit about our campaign that is occurring this month called November. Then I have the pleasure of introducing Dr. Helen Blake, who is going to be giving a presentation on neuropathic pain, which we are really excited about. And then we will end with a Q&A. So a couple of items before we begin. Just remember that questions will be taken at the end. And know that we really cannot answer highly specific medical questions. So please try to keep them general. To ask a question, if you're tuning in via Zoom, you can type it in the Q&A icon that should be at the bottom of your screen. On Facebook, please type it into the comments, and then we will be asking those at the very end. Our chat is open, but we really do want you to remember to be respectful and mindful of one another. And then all webinars are recorded and they will be posted to uspainfoundation.org/webinars. So if you have to jump off for any reason, or you missed something, or you also want to share it with friends and family, you can go there and find it at a later date. So we do want to just disclose that this webinar is educational only. It is not meant to take the place of your healthcare provider, and you should always consult with him or her about your unique health situation. And US Pain does not recommend or endorse any one therapy, treatment, or product. I want to start by thanking our sponsors of tonight's webinar, as well as our November campaign, Oxygen and Vertex. Thank you so much for your support of this really important initiative. And finally, I want to start just by sharing a little bit more about this month. As I mentioned earlier, November is labeled November, the month of knowledge, and it is an educational campaign that US Pain Foundation created. This year, our theme is on neuropathic pain and the impact it has on real people. So throughout the month, we are sharing facts about neuropathic pain on social media. We have weekly articles that are focusing on different aspects of neuropathic pain. We have an educational handout that you can download or print to share with others. And we will be having a Twitter chat November 30th, which we're excited about, with guest Karen Duffy. We have For Grace, as well as Peter Abachi. To learn more just about this wonderful educational initiative, please go to uspainfoundation.org/November/neuropathic pain. And just to quickly touch on, and I'm sure Dr. Blake will also be touching on a lot of this, the reason that we chose this topic is that neuropathic pain affects between 7 to 10% of the US population. And it can be caused by such a wide range of diseases and injuries. And knowing that chronic pain affects 50 million Americans, which is over 20% of the population, neuropathic pain is the leading cause of pain in the United States. And we hear a lot from our community about neuropathic pain. And so we hope that the information we are providing throughout this entire month informs you and empowers you and leads you to advocate better for yourself when you are talking with family, friends, coworkers, and definitely when you are meeting with your healthcare providers. So with that, I am pleased to introduce our presenter tonight, Dr. Helen Blake. She is a board-certified anesthesiologist and a board-certified pain management specialist. Her compassionate, patient-centered, comprehensive pain management techniques help her patients manage their pain and minimize their dependence on different types of therapies. And really, she strives to give her patients the results they need to live their life. She specializes in the care of patients who have been injured at work or in motor vehicle accidents. And she really has devoted the past 9 years of her practice as pain and rehabilitation specialist of St. Louis to the comprehensive care of our patients. And she stays current on the most novel of therapies and innovative treatments, which is really great because I'm sure that a lot of people in this community are going to have questions for you about what some of those might be. She is also the author of Move Freely, Get Your Life Back After Injury. We are so excited to have her and really appreciate her time tonight. And so with that, I'm going to turn the floor over to you. I'll stop sharing my screen so that you can start sharing yours. So thank you so much, Dr. Blake. We're really excited to have you here.
Thank you, Nicole. It's nice to be here. I appreciate the opportunity to talk to your audience, and I'm really excited to help educate a little bit more about nerve pain. As you mentioned, nerve pain is a really complicated process that affects a lot of different patients, and honestly affects a lot of patients that don't even realize that that's what they are having until they find someone who identifies it. So it can create pain that's very concerning and frustrating. Just the other night, my 4-year-old fell asleep on her arm and she comes in screaming, "Mommy, I feel like there are ants crawling on my hand." And I thought to myself, like, how terrified and frightening that was to her, and only can imagine patients who have to suffer with that feeling all the time. So I am, as you stated, board certified in anesthesia and pain management, and I practice in St. Louis, Missouri. I partner with a peripheral nerve surgeon very closely and have a significant number of patients in my practice that suffer from a variety of different nerve injuries. I've been speaking mostly to other physicians, and this is a really great opportunity to speak to this number of patients. So I'm just excited about it. I'm a member of a few big societies that help educate other doctors in the treatment of different types of pain. And then I put the website of my practice on here as well. So first off, when it comes to nerve pain, it is very prevalent, and it's really important to realize that you're not alone with the way that you feel. Physicians vary greatly in their understanding of neuropathic pain, and that probably makes it one of the more frustrating diseases to treat, because a lot of patients bounce from multiple doctors before they really ever get any reasonable step forward in their care. They endure multiple EMGs and nerve conduction studies, and it seems like every time they go to another doctor, they're starting over from the very beginning, which can create this frustration. Unfortunately, a lot of my colleagues are also not really great at communicating. And so a lot of patients get really concerned that people think that it's in their head. They don't feel validated. And that all causes augmentation of this delay in treatment, which just in the long run just decreases your quality of life, and makes it more likely that you're going to become disabled from this pain. Another way that nerve pain really is a feature in patients is that almost 90% of the patients that suffer from nerve pain have symptoms that occur almost all the time. So it's not like you have a break from this pain, like someone who has arthritis who might say, "Oh, my pain's really, really bad in the morning, but once I get up and start moving, it starts getting better." You're really suffering from this pain all the day, all the time, every day of the year. So it really can have some dramatic impacts on your mental health. And so I'm going to explore kind of a comprehensive body of nerve pain to try and get you all just kind of on the same board of where I'm going to start this conversation. There are two different types of nerve pain: nociceptive and neuropathic. So a lot of times when patients come in and I'm recommending a certain amount of treatment, and they'll say something like, "Well, I have this burning pain and I've been taking 3,000 milligrams of Tylenol a day and it's just not helping." Well, Tylenol isn't really a great treatment for neuropathic pain, and that's because neuropathic pain and nociceptive pain are different. So nociceptive pain is pain that's kind of run-of-the-mill pain. It's usually caused by a trauma in your body, like arthritis, broken bones, post-surgical pain. And it also has the feature that it tends to go away as that body heals and as your inflammation gets better and better controlled. Neuropathic pain is actually due to a disorder of the nerves not working properly. So it very, very quickly becomes chronic if it's not intervened with soon enough in the process of care. Any of you that suffer from neuropathic pain know that it's associated with the tingling feeling, the burning, the numbness, and it's often unrelenting. So there are lots of causes of neuropathic pain, and they kind of fall into 4 different categories. And there are so many causes that this is by no means a comprehensive list. I don't have a slide big enough to create all of the different ways that nerve pain can be caused. But essentially, you can think of it as 4 columns. You can think of it as a disease process that's happening in the nerve, compression to the nerves that's causing issues, like my daughter falling asleep on her arm funny. That's a compression problem. Then there's also just injury to the nerves, things like surgical injury, amputation, trauma, and the like. And then there's also central nerve pain. And central nerve pain is kind of a less recognized level of nerve pain. And this is what some people classify fibromyalgia as a centrally mediated nerve pain problem, multiple sclerosis, Parkinson's disease, and also post-stroke pain, which a lot of people don't realize that after strokes, you can actually suffer from quite debilitating neuropathic pain, especially in your shoulders, that often goes unrecognized and undiagnosed by multiple doctors before you achieve treatment. In terms of diseases to the nerves, that's probably the bucket that is one of the more common causes. Well, I would say compression and diseases together. Diabetes of the disease processes is probably the most common cause of a diseased nerve causing pain. Other common ones include alcohol abuse and use, sometimes medication effects, vitamin B12 deficiencies are also very common. Metabolic syndrome is a process of people developing high triglycerides, high blood pressure, and becoming pre-diabetic that also contributes to nerve pain. So what they're finding as they continue to research diabetic peripheral neuropathy is that there's about 30% of the population that suffers from metabolic syndrome that are developing burning in their hands and feet. And it's actually an early metabolic neuropathy that's occurring because of their altered blood sugar states that are caused by insulin resistance and metabolic syndrome. Another really common cause of a problem to the nerve that often goes unrecognized for a long period of time is post-surgical nerve pain or after injury. So patients who have had an amputation develop pain. And this is different from phantom pain, where you have pain in the limb that was removed. It's actually more conducive to stump pain, where there might be a neuroma or an injured nerve that just during the healing process hasn't healed quite right. But all of these can contribute to it. Compression of nerves is kind of the most run-of-the-mill ones, things like carpal tunnel syndrome, thoracic outlet syndrome, lumbar disc herniation. Most of these are approached with a surgical, usually have a surgical solution to relieve them once they're diagnosed. So a lot of my patients kind of look at me and are curious about how exactly something like diabetes damages nerves. And I wanted to go over this a little bit because it really has a lot of relevance to how any disease process can damage nerves. And basically, the small nerves, especially the nerves in your hands and your feet, are very small and delicate, and they need both oxygen and glucose to survive. So when you are a diabetic or have metabolic syndrome and you have frequent periods of uncontrolled blood sugar, that directly damages the blood vessels that feed the nerves. I once watched a Dr. Oz show where he was talking about how diabetes affects like the kidneys and the heart. And he described it as, if you imagine there are little grains of sugar in your blood that are literally scratching the inside of your blood vessels and causing damage. That's the major problem with high blood sugar, is that every moment that your blood sugar is too high, that sugar is literally causing damage to the inside of your blood vessels. When you couple that with high blood pressure, which almost all diabetics have, you're also increasing the pressure. So now you have not just the grains of sugar, but you have a pressure valve that's just pumping that sugar against the wall of the blood vessels, causing more damage. Everything in our body is fed by blood vessels, including the nerves. So what happens in diabetics is that the nerve ends up essentially being damaged or losing its ability to send normal signals because of the damage to the blood vessels. This is similar to why diabetes causes retinopathy, which is a problem with the optic nerve of your eye. It's the same type of process. It's basically the nerves aren't getting a proper blood supply. Another thing that blood sugar does is it actually changes the signaling of the nerves. It can actually slow how the signals are processed across what's called the myelin, which is the sheath around the nerve that protects it. So when myelin is intact, the nerves conduct properly. And when myelin is damaged, they don't conduct as optimally as possible. Diabetic patients also have very high levels of inflammation, which that as a core basis damages nerves. And inflammation plays a very large process in a lot of the other disease states, like lupus and autoimmune disease state neuropathies. So on that, the treatment of neuropathy has multiple levels. And the first one that I'm going to talk about is the one that I think, in my opinion, doctors talk about the least, which are lifestyle changes. They may mention it in passing, stop smoking, get your diabetes under control, but then they spend 2 minutes with you and they just send you out. And well, how do you do that? You know, if you suffer from diabetes and can't get your blood sugars below 120, 180, you can't just wave a magic wand and all of a sudden have blood sugars that are in the 120s. I'm also going to talk a little bit about medications, but most of patients that suffer from nerve pain likely have been educated by their doctors about the medications that are out there and may have even tried a lot of them. So I'm going to spend a little bit of time on that. Injections I'm also going to spend very minimal time on that. But then I'll also talk about some newer things, which are spinal cord stimulation, peripheral nerve stimulation, surgical decompression, and surgical nerve repair, to try and give you a comprehensive outlook of what different treatments to nerve pain are. So first off, there's actual multiple research studies as the impact of our lifestyle becomes more and more apparent, that actually show that there is no pill when you're talking about diabetes, high blood pressure, or I should say pre-diabetes, high blood pressure, nerve pain. There is no pill that is better than actually showing up and making diet and lifestyle changes. So really you have to make your body the healthiest vessel possible to heal from whatever ails you, but obviously the topic here is nerve pain. And if you think about that, you know, a lot of people question that. But if you think about, there's an old adage when I was a kid that if you drop a tooth into a vat of Coca-Cola, it dissolves completely with time. So, you know, you put corrosive things, sugar, acids, inflammatory causing things in your body, you're constantly fighting against an uphill battle where the pill might be able to do something to help. But if you're constantly creating an environment where your nerves are being poisoned, you're just not going to make any big forward gains. And so as hard as these diet and lifestyle changes are to make, making small changes one by one can make a big difference in your pain and how your nerves regenerate. So first off, how do you create the best environment for your nerves to heal with the food that you eat? And so the focus needs to be on a high quality, I call it a vegan adjacent diet, because I think most Americans would have a really hard time becoming purely vegan. It's a very hard lifestyle to go to when you go from eating McDonald's to eating all vegetables. That's a big jump. But if you can try and incorporate at every meal a few more vegetables and fruits that are multiple colors, high in vitamin C, berries, citrus, apples. Avocados are a great food. They're rich in healthy fats. They're high in potassium, which aids nerve conduction. And then magnesium-rich foods, which includes the nuts, the beans, quinoa, things like that. What eating this type of a diet is going to do is it's going to limit the inflammation that you're constantly causing in your body, okay? So if you were going to, say, wash your white towels, you wouldn't wash your white towels in dirty water and expect that they're going to turn out white. You want to keep them clean with clean water, right? And I don't know if that's a great analogy, but that's the first one that came into my mind. But the point is that if you're eating diets that are high in sugary foods like Coca-Cola and pastries and candy, and you're constantly creating your blood sugars, even if you're not diabetic, you're constantly creating little blood sugar spikes in your body. If you're eating foods that are high in simple carbohydrates like crackers, pasta, baked goods, Drinking alcohol. Alcohol directly influences the B12 and how B12 is exchanged in your body. So it actually slows nerve conduction, which whenever you've had a few drinks, you probably feel that right away because it dulls your senses. It's also dulling all of the senses in your nerves in your body as well. Processed foods, and then aspartame is a big one, artificial sweeteners. More and more, I feel like artificial sweeteners were really, really prevalent in the 80s and 90s. And then through the last maybe decade or so, you don't see foods that have the sugar-free, but now I've noticed in the last 3 to 5 years, labeling of sugar-free or diet foods has changed, where they don't really project themselves as having artificial sweeteners. And so these are products like where they say sugar-free Coke, right? That, like, I don't know if you've seen that labeling in Target or Walmart, that they're not calling it Coke Zero or Diet Coke, they're calling it sugar-free Coke. So you think, oh, it's sugar-free, it must be good for me, but they still have the aspartame and the artificial sweeteners that can cause issues with people who have nerve pain. So another thing that can be really helpful are supplements. And just as the disclaimer, and I know Nicole stated that this was all for advice, some of these supplements may interact with medications that you might be on. And so just be advised, if you want to try any of these or research any of these, to talk to your doctor. B complex vitamins. So B complex vitamins are necessary in our body to have our nerves function correctly. And these are vitamins like thiamine, folate, and B12. So folate is supplemented pretty freely in our cereals and our breads, but some of the thiamine and B12, you actually have to really work to actively supplement, because our body, they're all water soluble, and our body will flow that the vitamins out very freely. Magnesium is another vitamin that really helps with nerve conduction. It actually slows nerve conduction. So people who have that burning, tingling pain, it'll calm it. And the best supplement that I like for magnesium is a product called Natural Calm. No endorsement really, but it's a widely available supplement that's in the stores, and it actually helps you sleep, which is something that people with nerve pain often suffer from, is poor sleep. And so it has it's a magnesium supplement. You take it prior to bed and it will help calm you before you go to bed, but it will also have the impact of helping your nerve pain. You can also take magnesium topically. So if you've ever walked down the constipation treatment aisle of a pharmacy, you notice that most of the things that you use to treat constipation have magnesium in them, milk of magnesium, things like that. That's because magnesium functions as a laxative. So when you take magnesium orally, like in the supplement that I said, Natural Calm, it gets flushed out of your body through your bowels very quickly. But magnesium is actually topically absorbed very well. And so you can buy products that are a spray-on or a roll-on magnesium, like that have like an oil of magnesium in them. And those will absorb readily through your skin and actually work to improve the nerve conduction in your body and absorb into your blood better. Another way to get a really great high quality magnesium is in those float spas. If anyone's seen those crop up in their towns, those float spas are basically big Epsom salts bath, and Epsom salts are magnesium salts. So I have multiple patients that will go and they'll do like a weekly float, and that helps maintain their magnesium levels because they're absorbing all of that magnesium through the biggest organ of their body, their skin. Vitamin C creates collagen, which anytime you're supporting the collagen, you're supporting the fibers around your nerves, that it's going to help support nerve pain. You want to be careful with vitamin C if you are on any of the anticonvulsants like gabapentin, because it can interact with gabapentin. The alpha lipoic acid, acetylcarnitine, and N-acetylcysteine. These are 3 supplements that can be really helpful for nerve pain. And they're ones that most of my patients before they've seen me have never heard of. Most of them have heard of the B complex vitamins. They've read about magnesium, but maybe never tried it. But these, they've just never heard of. These are all antioxidant supplements, and they have different functions. So the alpha lipoic acid will help lower your blood sugar and improve your nerve function. So it actually helps improve the conduction and slows that deterioration that I was describing that can happen with high blood sugar in diabetics in all people. So it can help in all people. Acetyl L-carnitine helps create healthy nerve cells. And then the N-acetylcysteine can actually treat the neuropathic pain, but its core function is decreasing inflammation. Speaking of inflammation, curcumin and fish oil are also wildly anti-inflammatory and great supplements to use in people who have nerve pain or really any type of pain. So another place that people often have not tried to support is their microbiome. And this is definitely research that has increased over the last 5 years, definitely since I've been out in training. The essential support to the microbiome has become more and more apparent in the treatment of pain. So the best probiotic that's been actually validated in research for nerve pain is Lactobacillus paracasei. And you have to look the different brands. Most of the major brands don't have, they have single microbiome. They have single like organism, products. So those are things that are like, I can't think of the name of the most common one, unfortunately, but they usually don't have these specialized organisms. The best way to find a product that has this organism in them is to either search with a nutritional health store, like a supplement store, and they can find in their roster of products a product that has that in it. But in general, probiotics will improve your immune function. And when I say immune function, when you have inflammation and you have a reaction of your immune system, it stops working quite right. It's overactive. And so probiotics can help calm that overactivity while decreasing inflammation. So it actually like decreases what your immune system has to respond to, but also makes your immune system respond better to the assault that it's facing. Another way to support your microbiome is with what's called a low FODMAP diet. And this is a diet that kind of goes a few steps farther than the nutritional guidelines that I shared with you earlier in a few slides ago. It's focusing on very specific foods that limit the inflammation that develops in your gut. So if you've ever heard of things like leaky gut and things like that, low FODMAP diets are usually prescribed to limit what people call leaky gut. And that decreases the inflammation in your body. Low FODMAP diets, I mean, I could do an entire 2-hour presentation on just that. So that's something best to like Google. There are lots of really good resources that describe exactly what that diet entails. And lots of great books actually too. Vitamin D supplementation is essential for supporting your microbiome. The way that the vitamin D works in your gut also helps to decrease inflammation and helps to maintain the membrane intact to decrease that immune function as well. So managing your mind is a really big deal as well. Because you're suffering from pain 24/7, it's really, really easy to get caught up in thoughts that limit you. And I don't think that one's thoughts are the whole source in fixing anything, but it certainly can create improvement. And an example that I'll describe that's not pain related is just simply like this morning, my girls were getting ready in the morning and decided that maybe we would create a competition to try and get out of the house as quickly as possible. And my older daughter was losing the competition, and it was a big dramatic freak out attack, for lack of a better word. And she and I sat down with her. I was like, "What's going on what's going on in your mind?" And she's like, "If I don't get first, then you're going to be mad at me." And I'm like, "No, I'm not going to be mad at you." Like this, but it's the same kind of thing. We have these thoughts, and we show up because of our thoughts. What thought drives us? So if you wake up in the morning saying, and I hear this from patients all the time, I don't want to do X, Y, and Z because I'm afraid my pain will limit me. But then on the side note, say, I'm so sad because my pain is limiting me. I wish that I could do the things that I wanted to do. You're actually creating a parallel no-win situation, right? And working through that with cognitive behavioral therapy, biofeedback, meditation, can it help? Can it fix the problem? Probably not, but it will absolutely help. And making and we're going to talk about activity down the road, but with this, making small steps where maybe you recognize a thought that's limiting you. Like, I hear this frequently. Well, I can't walk because I have this terrible pain in my feet. And you may not be able to walk for an hour, right? Which is what people say is what you need to, maintain your weight and things like that. But you probably can walk to your mailbox and back, and you probably do that. And if you do that once a day, then maybe tomorrow you can do it twice a day. When you've lost your ability to do the things that you like to do, you have this thought that you need to do everything that you used to be able to do, when really, if you take small steps forward, you're going to get closer and closer to what you were able to used to be do than if you just never do it at all. Or if you go like full on hell's bells, I'm going to go walk 30 minutes and then suffer and fall backwards and say, oh, well, I'm never going to do that again. You're never going to make the progress. But if you just accept, okay, well, I can't walk 30 minutes, but I can walk 2, you're going to move forward faster. Meditation is really helpful. So meditation, there's a lot of mindfulness and meditation because anxiety can become so prevalent in patients that develop nerve pain. And when you think about it, the nervous system, your brain is a collection of nerves, right? So if you have nerves like complex regional pain syndrome, for example, complex regional pain syndrome is a condition where patient's sympathetic nervous system, a nervous system that you have absolutely no control over, the same nervous system that makes your heart pound when someone's creeping behind you on a dark alley, or makes your heart pound when you don't know whether you're going to open an acceptance from your college of choice in the mailbox. You have no control over that feeling, or maybe the heart pounding when you think about getting injected with a needle. You have no control over how your body responds in that, but you do have control over your breath. You do have control over letting yourself escalate into that feeling. And meditation can help center that and take that moment for yourself to realize what you have control over, which is your breath and your being. In terms of movement, I did talk about that. Managing expectations is the biggest impact when it comes to managing your movement. There isn't a single neuropathic condition that doesn't benefit from some targeted physical activity. So for the case with complex regional pain syndrome, for example, that's a condition that a lot of patients are really reluctant to move. You start with just desensitization, exposing the limb that's very uncomfortable to different feelings. Can start with just temperatures of the water. And a good physical therapist should guide you through that without causing you escalation of your pain. Once you get through that period of physical therapy, again, doing targeted exercises that help stepwise fashion improve your condition will go a far way. Another piece of advice that I have about movement is approach what hurts with curiosity rather than fear. And what I mean by that is that if you, let's say, are stretching, and I like to advise my patients to do, when they're really reluctant to do any activity, I like to advise them to do a stretching. And that kind of combines a meditation with a physical activity. But you can move every single joint in your body through a range of motion. You start with your ankles, flex your ankles back and forth. You start with your knees, you move your knees back and forth. You go to your hips. Maybe you squeeze your quads, bend your back, as much as you can forward, as much as you can backwards, move your shoulders through its range of motion. And then really be curious when you feel something that's different or new. Be curious about that. Like, does it reproduce? Do I feel it on the other side? And I think that when we have curiosity about our bodies and familiarity with our bodies, rather than fear of movement, that we end up kind of realigning that relationship with our bodies when we may feel relatively victimized or violated by our bodies when our bodies start to hurt out of control, beyond our will. So medications for nerve pain. Most patients that I see have already been on some combination of these medications. the biggest problem that I often see is that if you've never seen a specialist that specializes in nerve pain, they'll start medications at a remarkably low dose. And when it doesn't work, they'll give it up. And most frequently I see this with gabapentin. And I can't tell you, I mean, if I had $1 for every patient that has said, I've tried gabapentin and it didn't work. And then when I ask them how they tried it and they say, well, my doctor gave me 100 milligrams to take before bed. And I was like, okay, well, did he ever increase it? No, it just didn't work. And how long did he give you? 3 months, it didn't work. And they never escalated it. And that's just because that doctor wasn't trained in how to prescribe gabapentin. Gabapentin is a medication that has been very well validated in multiple studies, where if you have to turn to a pill to help your nerve pain, gabapentin and then also subsequently Lyrica or pregabalin are two that really are very, very validated and effective. But they have to be escalated to a certain dose, and you have to escalate them in a very cautious way so you don't become off-put by side effects, because there are a lot of side effects to these medications that are consistent and that are reproducible among multiple different patients. Antidepressants are another treatment that is probably the best first-line treatment for nerve pain, even better than the anticonvulsants, pregabalin and gabapentin. What I find with antidepressants is that a lot of times a patient has come to me not having tried antidepressants, and I'll say, let's try an antidepressant. And it's like, oh, no, I'm not depressed. Well, in this case, antidepressants are not being treated for depression. They're being treated because of the way that these medications function on the nerve. So if earlier in my presentation, I made the statement that your brain is just a collection of nerves. When you have a depression, your brain, the nerves in your brain are firing, and that's creating chemicals in your brain to fire differently. But when you have a neuropathy or a nerve pain problem, you also have nerves that are misfiring. And the same way that antidepressants can help the misfiring of the nerves in your brain, it can help the misfiring of the nerves in your hands, feet, limbs, and the like. And so while they may have the secondary side effect that's good, because a lot of patients with nerve pain do have a little element of depression, but in this case, that's just a side effect of the medication, because we're not using it at doses for depression. We're not using it to treat depression. We're using it to treat the nerve pain, and the dosing is actually completely different. So just keep that in mind if anyone ever proposes, let's try antidepressants for your pain. And then topical analgesics like lidocaine and capsaicin. Capsaicin is particularly effective with patients that have suffered from post-herpetic neuralgia after they've had shingles. And there are lots of really good prescription products that your doctor can use in the office to apply capsaicin that can provide remarkable results from that. Some other medications that are recently been tried, especially in the complex regional pain syndrome world, are naltrexone, which is a opioid adjacent medication, unfortunately has to be compounded in a compounding pharmacy, which makes access difficult for some patients, but has very promising outlook in research and in data for providing help with pain, especially nerve pain from complex regional pain syndrome. One of the limiting factors of naltrexone is that if you have had opioid medications for your nerve pain to help facilitate your pain control, the naltrexone won't work. You want to be free of opioid medications before you try the naltrexone, because they actually compete against one another. So there are also stimulation options for pain. There are external stimulators and there are internal stimulators. I wanted to just kind of discuss and talk about those. So TENS stimulators, TENS actually stands for transcutaneous electrical nerve stimulation. And so when you place a TENS stimulator, which are externally placed electrodes with a little generator, and it creates kind of a tingling sensation through the nerve, you're actually basically forcing that nerve to have an action potential, which re-guides its chemical kind of composition. And that's how TENS units can kind of help to improve nerve pain, not just while you're wearing it, but also after a session of using it, because it actually resets that nerve. Much like capsaicin. Capsaicin works on nerves because it makes the nerve spit out all of its neurotransmitters all at once. And it takes time for those neurotransmitters to build back up, similar to how TENS units work, as they just force that depolarization of the nerve. Percutaneous electrical nerve stimulation is actually something that I have never used, but some neurologists and chiropractors will use it. It's when they place acupuncture needles in spasmed muscles and send that electrical stimulation through the muscle. It can be effective, from what I understand from patients who have tried it. And then repetitive transcranial magnetic stimulation, again, something that I have never utilized, but this is also a product that is being marketed to naturopathic physicians and chiropractors and such, that involves basically electrodes on your head that will stimulate the nerves downstream from that. And unfortunately, I don't know much about that, but I wanted to be comprehensive in just introducing you to all the things that I knew that were out there. In terms of internal options, I have a significant amount of experience with the internal options for neurostimulation. I implant these in patients frequently, and oftentimes they're life-saving. And so I just want to go through some of those. Most of the slides that I had when I was trying to create this presentation, unfortunately, were proprietary. They were labeled by the different companies. So this is kind of going to be a slide that I discuss a little bit more than have any like visual support for. But the first is called a dorsal root ganglion stimulation. So this is a very like complex string of words. But what that's basically referring to is every nerve in your body comes off of your spinal cord and comes out of a hole in your spinal cord called the foramen. And in that foramen is something called the dorsal root ganglion. And it's kind of the collection of nerves where the nerves are being organized to be sent down to your limb, okay? So we can place very, very small electrodes that are very similar to the electrodes of a TENS stimulator in terms of their function. They create stimulation, they create vibration. But these are very small leads that are hair-like almost, and we thread them into your back and next to those dorsal root ganglion where all of the nerves come off of your spinal cord. What that does is it overrides the signals between your brain, where you're perceiving the pain, and your limb, where you're feeling the pain. And it can interrupt those pain signals. Some places where dorsal root ganglion stimulation specifically are really helpful are places where you have a known nerve problem. So for example, patients that had an inguinal hernia repair, and after the inguinal hernia repair had some significant abdominal pain that was nerve related, can often have benefit from a dorsal root ganglion stimulator placed in very specific and precise areas in the spine. When people have more generalized problems like CRPS, which can affect both limbs and even grow with time, although CRPS can respond well to to a dorsal root ganglion stimulator when it's very localized. When it becomes more generalized, sometimes you need something that's more general in feature. People that have chronic lumbar radiculopathies can benefit from dorsal column stimulators. And these are traditional spinal cord stimulators that are placed like epidurals. They're placed like epidural catheters, much like a thread that's threaded into your back. And then these devices are connected to essentially a pacemaker that generates impulses. Everything's under the skin. The best thing about these stimulation options are that there's a trial involved. So there are very few things in medicine that you can try before you buy. So if you've had a surgery, for example, and you go in with surgery and you're thinking, oh, I really hope that the surgery works. I really hope. And then in the post-op area, you're like, I don't think it worked. I can still feel it. Well, that's a big bummer, because now you've changed your anatomy. You've had an incision. You have a recovery from surgery to go. And everything in medicine is a little bit of a lob. It's a little bit of a hope, because there's nothing that's 100% in medicine. In this case, I can tell, and I can assure any patient, if I put a spinal cord stimulator trial in you, you will have experienced it, and you get to decide, do you like it or do you not like it? Does it improve your pain or does it not improve your pain? And then if it does, and if it does help you and improve your function and improve your quality of life, then it's totally reasonable to implant it. Newer on the market is a peripheral nerve stimulation. So these are devices that are not placed in your spine, but they're placed instead very close to a nerve that's been injured. So places that peripheral nerve stimulation can work really, really well are places where you've had a direct nerve injury. So people who have maybe had cubital tunnel syndrome surgery, where they've tried to have their ulnar nerve released, and something's occurred, and that nerve pain has has continued despite that, pardon me, despite that compression. An amputee who has a significant nerve pain after amputation also can benefit from peripheral nerve stimulator, where these are placed under the skin, usually with ultrasound in a minimally invasive way. And there are multiple different types of peripheral nerve stimulators. So one type of peripheral nerve stimulator can be implanted, and it's just a 60-day course of therapy. And then it's explanted. And that's particularly useful in stroke pain, although there's some evidence that it's useful in patients with chronic neuropathies as well, because the function of somehow it resets the nerve where the nerve stops hurting. But they can also be implanted permanently, where you would have a little, you usually would have to wear like a little, either a sticker that's attached to your skin in the area where the lead is, or you wear like a little puck that's in your clothing that communicates with the stimulator. It's not something that you have to use all the time, but you have it in your back pocket of, I can use it or not use it based upon how I feel. And a lot of times, just like I mentioned with the 10 stimulator, you use it for a period of time, and that actually gives protracted benefit where you might use it for a few hours, but then for a few days you feel better. And that just has to do with how it works on the nerves. So that's kind of a global overview of different options for stimulation that I think are really important to know and understand that they exist more than any, because even physicians don't know that these things exist. So your run-of-the-mill family practice doctor or primary care doctor, or even neurologist, really has never encountered these particular devices in their training. So an option as well for nerve pain is surgical. So we talked a little bit about peripheral nerve stimulators and nerve stimulators. The placement of those really all assumes that there's no other reasonable solution for your pain. And one solution that is really helpful for a lot of patients is a surgical care. And just like I was describing with spinal cord stimulators, a lot of physicians don't know about them. A lot of physicians don't know that surgical care of the nerve has evolved over time. So when I was in medical school, which was in like 2003, I remember going on my trauma surgery rotation and general surgery rotation and encountering patients that had neuromas or problems in their nerves after surgery. And the surgeons would paint a really dire picture of, this patient's going to be with that pain for the rest of their life. There's nothing that they can do. That's it. But since then, there have been a lot of evolutions with nerve grafting, with different types of caps that can be placed around the nerves that allows them to grow back properly. And also sheaths that can be wrapped around the nerves that helps guide them to grow properly. And these all help the healing process, so that the nerve, rather than healing in a disordered or scarred way, it's healing in a orderly and less painful way. If you have had longstanding nerve pain due to a surgical problem or due to a neuroma or due to an amputation, any of these types of things, if you have a nerve pain in an area where there's a scar, for example, there's a very good likelihood that the right surgeon can fix the pain, and you can have restored feeling and function with these newer products. A lot of people, so when they've looked at how patients get referred to nerve surgeons, because many physicians don't know that that specialty of medicine exists, a lot of times it's physical therapists who have dealt with patients that refer them. So your surgeon, like let's say you had a knee scope, and after your knee scope, you had terrible knee pain. I have a patient in my practice that after a block for a knee replacement, they had terrible leg pain after their knee replacement. These are places where a peripheral nerve surgeon may be able to repair that damaged nerve so that you have your function and your sensation back. But that orthopedic surgeon may not even know that there's a peripheral nerve surgeon in the area to send to, because it's just a very rare and specialized physician. I shouldn't say rare, they're common, but very specialized. So then prior to this, I had asked Nicole if there were any questions out there coming from the people who had registered to attend, just so I could guide, my presentation to the audience. And there was a question about glial cell modulation. And I guess that there was a New York Times article that talked about the glial cells. And so I wanted to touch a little bit about glial cells. So glial cells, literally glial is like a Latin combination of a derivation of glue. So glial cells, when they were initially identified by anatomists, were just really the supporting structure around the nerve cells. So you have an actual like nerve cell with a cell body and an axon and dendrites, and then surrounding them are these cells, the microglia, the oligodendrocytes, and the astrocytes. And all of these are kind of the soup around the nerves, okay? And really, doctors didn't really know why they existed. They assumed that they were there just to provide nutrition and structure and support to the entire nerve complex. But as they've continued to research how nerves function, they found that they have a number of different effects that influence how the nerve that they're near reacts, and that it may be damage to some of these glial cells that influences the nerve. So just like the schematic that I talked to you about earlier about the diabetes, how the nerve needs a good blood vessel to be supported, the nerve also needs healthy microglial cells and glial cells to provide a good conduction of its impulses. And so these nerve cells, these glial cells around the nerve form three different main functions. Oligodendrocytes produce myelin. So we talked earlier about how the myelin is the kind of the sheath, the covering around the nerve that influences how fast a signal goes through the nerve. So the oligodendrocytes are what produce the myelin forms the protective covering that keeps those nerves healthy. The microglia are kind of the immune modulators of the nerve structure. So basically, if those microglia see a threat and they want to destroy it before it affects the nerve, they'll go after it. So you know, in immune function, there's something called a macrophage. A macrophage goes and looks for viruses and bacteria in your body and tries to, basically, for lack of a better word, eat it, digest it, and, you know, get it gone before it affects you and causes an infection. Likewise, the microglia, they surveil the area around the nerve and they destroy the threats to the nervous system. The astrocytes are the most abundant cell, and they actually have been found to have a direct effect on abnormal pain processing. And where they've seen this most frequently is with the abnormal reaction that some people have with high doses of opioid medication. So there's a phenomenon called opioid-induced hyperalgesia, where a patient who is on a narcotic has a higher dose of narcotic and their pain gets worse. And this is actually a very frequent phenomenon that occurs in like a startling number, I don't remember the exact percentage, but a startling number of patients who are on long-standing narcotics. They actually develop this phenomenon where more makes their pain worse. And that's the presumed way that occurs is through the astrocytes. These cells, the microglia, oligodendrocytes, and astrocytes, these glial cells, can be modulated. They can be modulated in two ways. One way is with medication, but right now there are no medications in the United States that modulate glial cells. In Europe, there are two different medications that are on the market in Europe that they use that have some promising results that are also newer medications. And the FDA does have several trials that they're supervising ongoing to try and help with the pain. But the way that we have to modulate glial cells right now is with dorsal column stimulation. And that's with a certain programming of a certain device made by a certain company. And it's a proprietary program that a spinal cord stimulator can stimulate your glial cells and potentially improve pain. I just saw, by the way, my children and my husband drive in, and that made me aware of the time that I've been talking for a really long time. So I apologize for that. I think I've gone over what our intended time was. So I hope that's not a problem, but this is the last slide, I think.
It is not. They keep going, but I just want to say we are getting such warm and gracious remarks in the chat, just saying how wonderful of a job you are doing at explaining this and making it easy for us to understand and follow. So
yeah, thanks. I appreciate that.
Thank you.
So my last slide is just to talk about steps forward. So the main thing is that, you know, there are my kids. Hold on one sec, okay? To make lifestyle changes. Oh, we're gonna have a visitor. Mommy's on a call. Will you let me 1 minute?
Are you?
Hi.
Are you Maya? Are you Emma?
I'm not, sweetie.
Will you give mommy a minute,
Oh.
please? The main thing is that we poo-poo lifestyle changes, but lifestyle changes really are, you know, just like if you're trying to lose weight, you can't lose weight without adopting a healthy diet. I firmly believe that you can't improve your pain without improving the thing that you're doing the most often and most regularly, which is eat. So you can't improve your pain without improving the food that's going into your body and the diet that you're taking to create an anti-inflammatory state. And then the other thing is find, if you're not satisfied with the care that you're receiving, find the right doctor to help with your nerve pain. And there are three main doctor types that I would suggest. And one is a doctor like me, a board certified fellowship trained pain management doctor that has an interest in nerve disorders. And you know this really, really quickly when you meet someone, because they either like know what they want to do right away or they don't. And it's that you can usually see a perception of discomfort. If someone's not comfortable with treating your problem, you're never going to get the care you deserve. And then the second type is a board certified peripheral nerve surgeon. These usually are a specialized plastic surgeon, an orthopedic surgeon, or a neurosurgeon that has extra training and interest in treating these peripheral nerve problems. And so the best way to find one of these is to either ask around, word of mouth, or I think that there are probably some sites that we can connect, like websites that we can connect you with, which I can talk to you about, Nicole, later if there's interest in that. And then also a neurologist with an interest in peripheral neuropathy. And that concludes everything that I had to present to you all tonight. So.
Well, thank you so much. First, I just have to say, this was so comprehensive and thorough. I took notes. I just was nodding along in agreement with so many things that you were saying, and also writing down things that I had never thought about. We were just hearing so much from the chat, just how nice it is to feel validated finally, as well as learn more and know that there really are doctors out there who understand and care enough about this topic and are willing to give up their time and expertise to help us along our journeys. So thank you very much. I do also want to say is that we have gotten an overwhelming amount of questions, and there is no way, sadly, just with the time today, that we are going to be able to answer all of them. Dr. Blake, if it's possible, maybe I can send you a couple of them and we could answer some, and then we could follow up with an article just answering some of the other questions we can't get to. But a couple, I just thought maybe I could take three and ask really quickly. So one was, a question was, I've been told that exposure to toxic materials can invoke diseased nerve pain. Could that be the case?
Absolutely. So the same way that when you are taking in a diet that's toxic to you, you can also be around toxic materials. So one of the biggest ones is mercury. And the best way that manifests is in your diet, because previously to that, the most common way that people were exposed to mercury was through their fillings in dental care. Mercury hasn't been in fillings for probably, I mean, since I was a kid, at least. I don't know when it was taken out, but right now the biggest way is mercury filled fish. And the mercury in fish has actually increased in recent years because of kind of pollution in our waters. So you just have to be really cautious about the source of the fish that you're getting. One of the fishes that can be high in mercury is tuna fish. And so it's hard to know what source your tuna is because you're buying it in a can. So you don't really know where it came from. And so, I would kind of recommend going, if you're going to eat tuna, to a source where you can talk to the person who's selling the tuna. And kind of cook it yourself if you love tuna and are trying to avoid mercury.
Great, thank you. Another question is, how often should we be taking probiotics?
So probiotics are best taken daily because you're constantly flushing through your body. One of the hard things with probiotics right now is that there are just so many on the market, and there are so many different organisms, and each of the organisms acts differently in the body. But probiotics, you have to take more than you think, and you have to take it daily.
Okay, perfect. Thank you. I'm just going to ask two more questions. What do you think of axon therapy? I've recently heard about it. I've lived with 10 years of nerve pain after a damage from surgery, and I've tried everything. And I'm not sure if this is something that would be helpful for me, and I didn't understand the treatment.
Absolutely. So as we were talking about with surgery, when you've had a surgical procedure and someone has cut your nerves, the nerve can grow back in lots of different ways that are not advantageous in terms of creating pain. They can create more pain. What surgeons do, from what I understand, and I'm not a surgeon, but I do know some, and I've seen some of them operate, is that they will remove the diseased or damaged part of the nerve, and they coat that nerve with these new agents that are made by companies like Axogen, who I believe was sponsoring of this presentation. Yes. So Axogen makes these nerve sheaths that are very protective and help nurture that nerve to grow appropriately as it heals. So that can remove the damaged part of the nerve, the part that's causing pain, and then protect the nerve so that as it heals, it doesn't recreate that damage again. Does that make more sense, Nicole?
It does, yes. And I'm sure that helped answer a question. This is a question that actually I have, and I think a lot of people that live with nerve pain. But is there any evidence or research or around climates and how that affects pain differently, especially with nerve pain?
You said climate, like the weather?
Yes, when weather changes.
So I'm not familiar with any like validated research studies, but certainly anecdotally, my patients describe whether they have nociceptive pain or neuropathic pain. Do they describe changes to their pain signaling when they have changes in the weather? And in general, warmer climates that are less humid are very conducive to having less pain, which is why we see lots of retirees go to Arizona, because it's a very hot, dry climate that doesn't have wide swings of temperature and humidity that can trigger these weather-related changes. I think that more research is needed to really validate and understand why that happens, because I'm not really familiar that they've solved that.
Thank you. Again, I could keep going on, but I do want to be mindful of everyone's time. I also know your little kids got here and they are so adorable, and I'm sure that they want to spend some time with you. So we greatly appreciate everything that you did with putting this presentation together. It has been so extensive and in-depth, and we just keep getting more and more thank yous. So we appreciate your time. I will be in touch, Dr. Blake, if you don't mind, just to share a couple of other questions so that we could get back to some other folks that we weren't able to answer questions tonight. For those that are tuning in, please know that this recording will be on our site, as well as a wrap up and a follow up to this presentation. So please be on the lookout for that. And for those of you that are also tuning in, if you want to learn more about neuropathic pain, which this is our month of knowledge, please go to uspainfoundation.org/November/neuropathic pain. Again, thank you to our sponsors, Axogen and Vertex, for supporting this initiative all month long. And again, Dr. Blake, this was fantastic. Thank you so much for all your time.
I'm happy to help. And I hope that all of you out there find solutions that you need.
Yes. Thank you all so very much. Have a wonderful evening.